Demographic findings. Although symptoms can initially appear at any age, most commonly it is as an adolescent or child, sometimes even as an infant or neonate at which symptoms first appear, though due to the nonspecific nature of almost every symptom of the disease, the diagnosis often goes unsuspected at the time, and for a very long time thereafter. In the author's and others' experience, most patients have been chronically ill for literally decades prior to diagnosis. In fact, because of the multi-system presentation in most patients, with symptoms in different systems often presenting at different times, and the general lack of awareness of mast cell activation syndrome in the medical community, at present most mast cell activation syndrome patients live their entire lives without diagnosis or even suspicion of the root issue underlying the plethora of problems, many of a generally inflammatory nature, that they often acquire. Mast cell activation syndrome patients often are regarded as inexplicably chronically multisystemically ill, perhaps recognized by astute physicians as likely having an underlying systemic inflammatory syndrome, though they don't fit the pattern of any well-known such syndrome, with typical diagnostic testing often yielding negative or borderline results, or perhaps results which are mild to moderate in their signal intensity but soon prove to be ephemeral. Though their presenting symptoms in any given system are most commonly subtle to moderate in degree, occasionally mast cell activation syndrome patients will present severe abnormalities, which may have emerged acutely, subacutely, or chronically in one system or another, such as end-stage renal failure or refractory diarrhea, with exhaustive diagnostic testing failing to reveal a specific etiology. In fact, and as another reflection of its heterogeneity, mast cell activation syndrome can present with polar opposite abnormalities in different patients. For example, gastrointestinal dysmotility principally manifesting as diarrhea in one patient versus constipation in another patient, or dyserythropoiesis principally manifesting as erythrocytosis in one patient versus pure red cell aplasia in another patient. Mast cell activation syndrome patients often respond incompletely or even outright poorly or intolerantly to therapies targeted at their superficially apparent ailments. Some mast cell activation syndrome patients have definitively diagnosed inborn or acquired ailments, such as sickle cell anemia or obesity, which come to be blamed by many of their physicians for most or all of their symptoms, even though it is difficult to explain many of these symptoms based on careful consideration of the biology of the definitively diagnosed ailment. When a patient, particularly a patient with chronic multisystem polymorbidity, generally of an inflammatory theme, presents, it is important for the physician to consider whether the presenting symptoms are typical for the definitively diagnosed ailment or not. If not, it is important to consider the possibility that a comorbid and potentially underlying and unifying illness may be present. Mast cell activation syndrome patients not uncommonly can identify a specific point in their lives, a month, a year, sometimes even a specific date, at which their general health took a distinct turn for the worse. Such points commonly follow, typically by days to weeks, but sometimes by several months or mere hours, acute events of either significant psychological or physical stress, such as the death of a family member or vehicular trauma, or of significant new antigenic exposure, such as travel or relocation. If they have recognized the temporal association between trigger and illness, such patients not uncommonly are quite convinced, even invested, sometimes for socioeconomic reasons, that the trigger was the cause of the illness. However, careful history taking virtually always reveals symptoms of mast cell activation syndrome to have been present long before the turning point, again often dating back at least to adolescence and perhaps even to childhood or infancy. The author typically asks his new patients to present their entire history chronologically, i.e., not merely starting at the turning point, starting all the way back at the last point in their lives at which they can remember feeling fundamentally, persistently well for a prolonged period. Even when specifically instructed as such, many patients will not recall some of the mast cell activation syndrome-driven symptoms from the earlier stages of their lives until much later points in the process of reporting their history. Thus, as will be emphasized again later, it is imperative in the evaluation of a patient thought to possibly have mast cell activation syndrome to take a lifelong history from the patient as possible, a time-consuming endeavor which further contributes to the diagnostic challenges of mast cell activation syndrome. History taking must include a complete review of systems as well, as many mast cell activation syndrome patients have been so ill for so long that they have come to accept various aspects of their illness as a baseline healthy state for them. Also, after extensive evaluations fail to identify a diagnosis, let alone effective therapy, some patients come to naturally omit certain aspects of their illness when providing their history, yet one more time to yet one more physician. For example, the author encountered one patient who had been suffering unpredictable acute non-orthostatic syncopal episodes on virtually a daily basis for 20 years. Extensive evaluation and empiric treatment efforts in the first 2 years after symptom onset were unproductive. His physicians at the time told him they had nothing further to offer him. The patient continued to suffer his syncopal episodes for the next 18 years and made substantial adjustments in his life to accommodate his risk for syncope at any unpredictable moment, though he never again mentioned the problem to any of the physicians he newly met over time. Only in an extensive review of symptoms was the stark symptom revealed. Another patient had suffered nearly daily syncope for 5 years following the birth of her first child, but had been told by her obstetrician upon symptom onset that postpartum syncope was common and would resolve in time. So she patiently endured 5 years of this life-altering symptom without mentioning it to any of her other physicians before an extensive review of symptoms brought it to light again.